Well, as a state, we're fat and getting fatter. Oklahoma now ranks in the top tier of all states in the girth of our waistlines. It's an issue that goes well beyond vanity, impacting not just our physical well-being, but our state's economic bottom line. Today, we try to get our arms around Oklahoma obesity. Elisa Hines starts us off.
Valerie McBain is stepping on the scales a lot more these days. She's part of a wellness group trying to lose weight.
Having 3 children pretty much back to back because they're 9, 7, and 6, there was a lot of being pregnant for a while, so you gain a lot of weight sometimes when you're pregnant, and so I plan to lose all, if not, part if not all of that.
A working mother of 3, McBain is like many Oklahomans, hoping to shed a few pounds.
Just finding time to fit in a healthy meal in between a busy schedule, 3 kids and a husband, and trying to do everything as you can. There's not enough hours in the day, really.
Valerie's story isn't unique. A growing number of Oklahomans are fighting the battle of the bulge. Recent statistics show 30% of the state's population is obese. Landon Norton is a nutrition coordinator for the state health department.
On the nutrition side, I really like that traditional Southern diet. So that's kind of been ingrained in us. That's how our parents, grandparents, great-grandparents cook.
Experts point to the usual suspects of expanding waistlines: poor food choices and lack of exercise. Reasons that make the disease not just a health issue, but a question of lifestyle.
So trying to eat enough fruit, drink a lot of water, that's the hard part.
Blame it on our modern-day society, where the lure of convenient food is everywhere and time limited.
More and more people are grabbing something on the way home from a fast food or restaurant establishment to feed their families as opposed to cooking.
In just 20 years, obesity has risen by more than 20% in Oklahoma, a trend that doesn't look likely to change by itself. So state officials have come up with a plan to help the state scale down.
There really needs to be a multidisciplinary, multi-agency effort at this, because it does involve how our society and our culture here in Oklahoma functions.
With so many Americans waging a war on weight, there may be comfort in numbers. But it's comfort that Valerie, for one, is working to lose.